Hi, Andres. Good evening.
Good evening, teacher.
How are you? How was yesterday?
Yeah, so tired.
Okay, you had a lot of practice to do, right?
Yeah.
Did you have the chance to watch the video of the last class?
Yes, I can.
Okay, let's continue then. So we were talking about high blood pressure, right? How would you manage the treatment of this condition?
Well, high blood pressure is a chronic condition, especially in adult patients. The treatment is it's pharmacology. We need to reset um, hypertensive drugs,
Hypertensive drugs.
hypertensive drugs. Um, yes, a diet without salt.
Without salt. Okay. Okay, those two things or anything else?
Uh, Two things.
Okay, what about coffee? Do you think it's important to supreme coffee or it's not a problem?
Yes, coffee too. Uh, say-
Okay. Can you name and describe another circulation disease?
I know in the university we talk about hypertension, hypotension,
Mhm.
for
Hyper
example,
hypertension.
hypertension. Um, yes, just that. I mean,
What about polyglobulia, maybe?
I don't know.
Okay. What about, I don't know, maybe, mm, what else? I don't know what kind of diseases do you know for circulation problems. Maybe thrombocytosis could be.
Yeah, yeah, thrombocytosis or problems in the tris- problemas en la válvula tricúspide.
Okay. Tricuspid valve problems or issues. Okay. Can you describe one of them or
Yes,
explain?
uh, yes, I believe that thrombosis is a disease that in the blood systems or circulation system form coágulo.
Uh, plot.
Blood, blood.
Plot. Remember, I will write it down here on the message part, okay? So you can remember. Plot.
Blood. Yes, a clot. It's called. Um, it's called that the the circulations stop in some areas, and the blood can follow the circulation.
Okay. Okay. And what are the causes of that?
You can repeat.
What are the causes of that?
Well, I don't remember much about the cause, but I think, for example, it can be hereditario.
Hereditary?
hereditary, bad element, for has a bad alimentation or mm, has a bad diet.
Okay.
Um, or
I I forgot. Okay, it was cloud. Okay.
yeah. Yes, I think
Okay. And how would you manage the treatment? Or in general, how do you think doctors manage this disease?
uh, I read that the most common pharmacological treatment for circulation system is anticoag
Anticoagulant.
anticoagulant.
In this case, it's called that. But let me check.
Yes, it's the most common a diet, a strict diet. Um, uh, Drinks much water, maybe. Too.
Okay. Yes, anticoagulant is the word. Okay, in this case. Just when we talk about the or describing the sign, in this case, will be clot. But when we are talking about the drugs, we can say anticoagulant. Okay. Okay, perfect. Mm, can you please, let me check. Can you describe to me the ranges of the vital signs?
Science.
Yes, pressure, temperature, right? Can you describe it, please?
Mm, the dangers of this.
No, you can give me the ranges.
The ranges. Um, I know, for example, pressure is 120 and 80 for normal pressure.
Yeah.
Um, Partial pressure of oxygen is 98 to 100. Um,
Oxygen, remember.
Oxygen.
Yeah.
Oxygen. Temperature is 37. Um,
The temperature?
Temperature.
Okay.
Mm, yes, I know this.
We have two more.
I don't remember. Herbit or
Yeah, but yes, when we talk about we count the heartbeats, right? Okay,
uh,
what is the
herbit.
range?
Yes,
I know you know.
a herbit is 70 uh, herbits per minute.
Okay, 70.
70.
Okay, yeah, that's good. Do you have any questions, any doubts of the class, or something that you're interested in?
I yes, I have a question. For example, for I'm trying to have a summary in my book, but I don't know if I eh, no sé cómo decirlo en inglés. I don't know if in the book in the textbook uh, are the same of the diapositive.
Yes,
Yeah.
I took some images from the book and put it on diapositives. Okay, it's everything we do is from the book. So you have, if you want, you can read it. I don't know. You have the records of these classes, right? So I think you can practice with the book on one side and the records on the other side. Okay. But if you need any other help, you can tell me.
No, it's all.
I'm still looking for a podcast so you can work on your listening as well as you work on your vocabulary. Okay. I will send to you my questionnaire. I don't know if you can see it.
Yes, I can.
Please fill it for me. And let me take a picture. Well, two pictures, I think. Okay, Andres, thank you so much. Since you weren't last on yesterday's class, we agreed with your classmates that you will replace the first class. Remember, we have one class to replace
Yes.
on Wednesday after the theoretical classes, okay? You can pick up your 15 minutes from 9:50 to 10.
Yes.
So at one,
Yes.
9:15,
Yeah.
it's okay for you? Okay, Andres. Okay, perfect. So you have your replacement class on Wednesday at 9:15. Okay?
Okay, teacher.
Okay, thank you so much. Have a good night.
Thank you.
Take
Goodbye.
care. Bye. Hi, Mateo. Good evening. Oh, you're mute.
Oh, sorry. I was
No
waiting for the
worries.
class time and the time just passed. I didn't
Oh,
realize it was time. So
okay. Yesterday you can come, right?
yeah, I couldn't. So I was outside I was in the street and I couldn't arrive on time to my home.
Okay, no worries. But we were talking about circulation problems. Okay.
Mm.
So, well, can you explain some disease of this kind of condition
Uh,
that you can remember right now?
did you say circulation?
Yes.
Yeah, circulation. So it might be hypertension. It's a very common disease. I think it's one of the most common diseases and one of the all around the world. And maybe the one of the most dangerous risk factors among the population to develop other conditions uh, because of hypertension. It can be caused by a lot of things. A lot of things. So I think the most important thing is the blood pressure is elevated, constantly elevated, even in rest, and the the danger here is that uh, if this increased blood pressure persists for a long time and it's made chronic, it may cause some damage to other organs and systems like brain and kidneys or even the heart, and is as I said before, um, a very important risk factor for other conditions.
Okay. And how would you make the management of a treatment for this condition?
First of all, I know we have to encourage the patients to um, low the salt intake. That's the first step. And the second, we have to evaluate the other conditions that the patients have, because commonly a patient not only have hypertension, it is not um, the primary disease. It often the patients often have hypertension and other things, other basement diseases, and we have to manage everything. It's not the same the manage of patient with hypertension with diabetes than a patient with hypertension for um, renal artery stenosis, for example. It's not the same. But for the common causes, you will have to administrate um, inhibitors of angiotensin converting enzyme and or um, angiotensin receptors type 2 blockers. that's the standard treatment in hypertension.
Okay, so that those are sorry, those are called how is the name that is so much common when I ask to my patients if they are taking some medicine or drugs, they tell
Yeah.
me each time
Enalapril
enalapril
or enalapril,
or
yeah,
losartan, for
or
example.
losartan, yeah, yeah.
Those are the most common ones, right?
Those are the most common, yeah. Other common medications are the I didn't remember the drugs that make you urinate more. Diuretics.
Yeah,
Diuretics.
diuretics, yes.
Yeah.
Okay.
There are different kinds of diuretics. It depends a lot of the patient's condition and characteristics of their disease and other factors. There is it's kind of art, like treating patients with hypertension. There are a lot of treatments, a lot of targets of treatment, and a lot of patients with different characteristics.
Yes, that's why doctors give them maybe you have to take it every single day, or you have to take it twice a day. And
Yeah.
I saw a lot of that. Like
Yeah,
this.
yeah, it's complicated. It's really complicated.
Okay, so it depends on the page,
Yeah.
on the characteristics. Okay. And can you name and explain another circulation disease?
Mm, okay, let's. It's also related with hypertension in some way, but it's I think is the most common cause of death in around the world. That is myocardial infarct. Okay, it's caused by an obstruction of some of the of either uh, the arteries that irrigated the heart, the coronary arteries. You know, is caused by either obstruction of any one of the arteries of these coronary arteries. One of the most common risk factors is dyslipidemias, like elevated cholesterol and triglycerides. Yeah. This condition can lead to cholesterol and triglycerides deposition in the coronary arteries, making a plaque of these components. This plaque is called atheroma, and very often, if the patient doesn't change his dietary behaviors, this plaque continues growing, and eventually it blocks the blood flow on coronary arteries, and that's the cause of the infarction, of the ischemia first, and then the infarction, or this atheroma plaque can break. This break may cause a thrombus, and this thrombus obliterates or obstructs the blood flow uh, of the heart, and this is the cause uh, the infection.
Okay. And everything starts on a good or bad diet, right?
Yeah,
These cases.
There are other causes that may
It can be
produce hereditary. The dyslipidemias, yeah, yes, and this may cause trauma plaque formation and other things. Yeah.
Okay, perfect. Yesterday we were talking about examination, a physical examination. Can you give me some example, maybe in general, how to make a physical examination?
Physical examination. Yeah. So we often start as a systematic examination. First, the head. We have to see the symmetry or asymmetries in the head. If there's a lesion, we first observe. We first observe, we inspect anything. Then we would touch the symmetries, imperfections, or some sunkens in the head. I don't know, or lumps in the neck or in the head. It depends that the side of the part of the body that we are examining. We often the logical next step is
While you're describing, sorry, while you're describing, can you please fill in my questionnaire?
Of course.
And continue, please.
Of course. The logical next step is the auscultations, where we wear the stethoscope and start listening to normal or pathological sounds in heart and lungs, or some arteries, or bowel sounds. And it's a lot of things. And sometimes we do percussion, so we can examine it by the resonance it makes the percussion. If there's an empty cavity or a mass below the site of percussion we're doing, it's also kind of art, but that are the steps, that are the system we follow to examine a patient normally.
Okay, but not always you follow the 4 steps. It's not necessary?
No, and sometimes, like in abdomen examination, you have to do the inspection first, then the auscultation, percussion, palpation and percussion. Yeah. Because if we palpate or percute before the auscultation, we can alter some the sound of vowels, the vowel sounds, and this will alter our diagnostic.
Okay, thank you, Mateo. Thank you so much. See you tomorrow.
You,
and just one thing, remember we have to replace the first class, right? So I have Wednesday from 9:30 after our class, from 9:30 to 10. What time do you think? Yes.
9:30.
9:30. Okay.
Yeah.
Okay. Thank you so much. See you on Monday. Take care.
See you on Monday. Take care. Have a good night. Bye.
You too. Bye-bye. Hi, Rina. Good night. I'm sorry.
Hello. Good night.
Okay. How is everything?
It's fine. Thank you.
Okay, that's good. Well, remember we were talking about circulation yesterday, right? So I want to know, how would you manage the treatment of high blood pressure?
Blood pressure.
The most common thing.
How like that? I'm sorry, I don't get the question, and I don't get.
Okay, imagine you have a patient with high blood pressure. So how would you manage the treatment of this condition?
Okay. Well, the treatment depends of the patient, of course. For example, if I have a patient, an adult, yeah, male, without any history about the blood pressure before, that is the first time that I discover he has blood pressure constantly. The treatment it begins with beta bloqueadores or some drugs. The first line of attention, for example, beta bloqueadores or the ARA. I don't know what is the name in English, or YECA, but it's the first. Yeah, in English, in Spanish is inhibidores de la enzima convertidora de angiotensina. For example,
like losartan and
no, the pril, captopril, enalapril, yeah. But the important things is about the treatment with drugs is the first treatment is use one drug, because affect not only the blood pressure, affect another parts. For example, the propanolol, atenolol, propanolol. Yeah, propanolol, for example, have a adverse effect in the heart, in the frequency, but it's a good option for the people who has a high blood pressure with some cardiomyopathy. Yeah. But talking about the treatment, yes, the first moment is the first for this patient that I show you, that is the, yeah, beta blockers. Thank you. For the patient that I show you, if the person told me and swear that I have never in his life blood pressure before, is the one drop plus better, what is a better diet without salt or low salt. In fact, it's the first step of the treatment, a good diet. After that, I have to show the patient if the patient have a weight. The second step is the implement exercise. Yeah. Good diet, exercise, low salt, and after that, probably it's better to start with a drug and control after in 2 weeks, and have a control, taking the blood pressure 2 times per week. Yeah.
Okay. And what about on diet, maybe? What about the coffee? You have to control it. You have to leave it. What is?
Yes, I have to ask. Yeah, I have to ask him about how cómo son sus tiempos de comida, how his time food or time.
How many times he eats, or he eats.
How many time he's
Day, you can say.
Yeah. Day per day. Yeah. What eat in the breakfast or lunch or the dinner, the schedule, and the kind of the food. And according with that, the coffee is, I have to restrict, the drink of the coffee, because there is person have is very there is person is very difficult to leave the coffee totally. I am one of them. And yes, so it's very difficult to say in a patient not drink coffee, and that is impossible. The patient don't obey you. But it's restrict the drink of coffee. If the patient have any problem about that, no coffee. And substitute the coffee for another time, for another kind of drink without caffeine or taurine, for example, chamomile tea, or the famous árbol de café or árbol de o café de maíz. That is not coffee, it's a simulated.
I never heard about that, but it's interesting. Okay.
Yeah, it's very rare, the preparation, in fact, but it's only the color. The taste is not coffee. I don't know, it's only the color. And yes, because the caffeine elevate the blood pressure.
Okay. Okay, Rina, that was perfect. Well, do you know another circulation disease? Can you name one and explain it?
What kind of disease? Everyone or
Circulation disease.
Circulation?
Yes.
Oh, the circulation without the blood pressure probably is it's a certain disease, thromboembolims.
Okay.
The thromboembolims is a problem about the circulation. There is a start. It's a start. Sorry, with a problem with specifically the blood, the number
consistency.
The consistency. Thank you. The consistency of the blood, because if the blood is very espesa or have a lot of cells, especially the plaquettes, you have the problem because the plaquettes is the mainly cells that start
platelets.
Platelets. Thank you. The platelets, that is the main cells responsible for the form of the thrombo, or the thrombo is without the heart, because there is different meaning about the coágulo and the blood. I don't know how is coágulo in English.
Remember, clot. C-L-O-T. Yeah.
Okay, clot. Yeah, the clot has different names. For example, if the clot forms in the wall of the veins, for example, it's called thrombo. Yeah. When the thrombo separate from the wall and running with the circulation, has a name of emboli. So with the thromboembolims, the problem in fact is that the high number of the platelets in the circulation, and another problem is about the velocity or the speed. Sorry, the speed of the blood of the circulation.
The speed.
Yeah. Sorry, I sometimes I think in French. So the thromboembolims is a problem. Yeah. So the thromboembolims, the problem is a problem very, very important in the woman, especially when the woman has an age of the 40 years. Has the problem, especially that disease forms at the level of the legs, especially in the saphenous vein, and because the veins from the legs has a valvules, valves has valves in the legs, and the moment has a the common problem that is doesn't work usually because there are different reasons. But the thromboembolism, that is a problem. The speed of the circulation, it causes about the speed of the circulation for the high number of the platelets, and about the fail of the valves in the circulation, in the safene circulation de la safena, yeah, safene circulation. And it's more problem in the woman because we works with the in the symptoms with the hormones, sexual hormone, progesterone, estrogens, and when we are in the age about the beginnings
Menopause?
of the menopause, yeah, about the menopause has a there is a start the problem because we are not protected anymore with that kind of hormones. So that is very complicated because it's very, very, very difficult that the man has that problem.
Okay, so it's more common, this disease, on women.
Yeah, but the treatment is very easy. So that problem is because we are not pay attention about that.
Okay, so let's do something to prevent it.
Yeah, one cause of the prevent. For example, we are very bad because we are like use high heels, and the heels is a problem because you have yes, you increase the pressure of the legs. So I like
don't tell
it
that
too,
to a woman.
Yes, but that you told it's prevent, but
yeah,
at the time.
Okay, Reina, thank you so much. And see you on Monday. Remember, we have our practical class on 9:45 with you on Monday after our theoretical class, right?
Okay, teacher.
Okay, thank you so much.
Thank you. See ya.
See ya. Bye-bye. Hi, Jorge.
Hello, good evening.
How is everything?
I'm doing good, thank you.
Okay, Jorge. You couldn't talk yesterday.
Yeah, I don't know what happened with my internet connection, but I will love that I could I could be able to participate, but actually I don't know if you were able to hear me well, so I prefer to skip for yesterday because my internet connection was terrible. I don't know what happened.
It happens.
Yeah.
It happens all the time, especially to me.
No, really.
Oh, yeah. Well, since we were talking about circulation, what can you tell me about high blood pressure?
Okay.
Everything you want about it.
Okay, high blood pressure is something that is really present right now, worldwide, I could say. It doesn't matter if it's a developed or non-developed country, because it is associated with a lot of pathologies. For example, diabetes, obesity, a lot of things that are really common to see nowadays. High blood pressure is something that can, if it's not well treated, if it doesn't have a treatment, it can lead to something worse. For example, something I see really frequently is have cerebral hematomas, and that's something that is often a cause of high blood pressure. So because patients do not follow their treatment, or I don't know, yeah, because of the treatment most of times. And yeah, it's something that can lead you to death.
Wow. Okay, I didn't know that. So you're saying that patients have hematomas because
Yes.
of high blood pressure?
Yes, because of sometimes there are some patients that may have, for example, let me find a word I'm looking for. Forgot it. When you have a malformation, a venous arterial venous malformation, and you don't know it, actually not, it's not common to know it, even if you actually you don't have symptoms due to that, in most of times, but when sometimes it can be really painful. Yeah, patients describe it as terrible pain they have never felt in their lives. So you make a CT scan
Mhm.
and see arterial venous malformation, and if the patient has high blood pressure and you don't treat the disease, in this case is you don't treat a malformation, there is the risk it can get broken, and you have uh, a bleeding, a tremendous bleeding.
Okay. And how would you make diagnosis, a differential diagnosis with leukemia? 'Cause I
With
think it
leukemia,
has, yeah, it has the same signs, right?
well, actually,
Hematomas or no?
um, when you have leukemia, you have to look for a lot of things depending on the type of leukemia. You have to look of, I think what I learned that the most common expression of leukemia is, regarding laboratories, is the leukemoid reaction. There is a super high count of leukocytes, over 50,000. So that's something you have to notice. It, I don't think other conditions show those numbers, those, because they're high
Levels.
numbers. That's why it's called leukemoid reaction. Also, with leukemia, I think it's really different with an hematoma, with the brain bleeding, because leukemia also, as all types of cancer, it leads patients to have type B symptoms. That's how we call them, and we're talking about um, weakness. We're talking about um, um, patients that sweat a lot. We're talking about also nausea, vomiting, all that stuff. So I think
Okay.
it's kind of different.
Yeah, different, right?
Yeah,
Yes. Okay, thank you.
no
Well,
problem.
another kind of disease that you can tell me about, maybe thrombosis or something like that.
Okay, regarding circulation system, we also have something really common that is called DVT. In American English, we use that those letters DVT. They are the deep venous thrombosis. And it is caused by, actually, there are a lot of factors. One of them is um, not having a good lifestyle, not having exercise frequently, because that's why it starts in the legs. So when you have deep venous thrombosis, you have a lot of risks. For example, pulmonary embolism, and that's something that is also really common in our, let's say, I don't know, in our society.
Mhm.
So that is another topic that must be discussed, because it's really frequent, and
Yes.
it's due to blood ecstasis, blood clots that
Mhm.
stuck into circulation, and they cause a lot of awful things. As I told you, pulmonary embolism is the most common complication of this disease, and it can lead to death also.
Yes. Yes. Okay. Getting back to high blood pressure, how would
Yeah.
you manage the treatment of this condition?
Well, it depends. It has some steps to follow, depending on the patient's age, depending on the patient's a previous condition. the patient's comorbidities, all that stuff. But I would say that one thing, the base, the base of the treatment is good diet, exercise, and eating with less salt, because it's the I have a problem with blood pressure, even if you don't believe it, because and I got scared. I got really scared.
Uh-huh.
Yeah, I was receiving my fourth COVID vaccination dose, and the nurse measured my pressure,
Mhm.
and it was 140 over 100, and I
Wow.
was like, I don't have high blood pressure. It's not like normal. And she told me, did you came walking or something, or did you do something that was not something with exercises? Or and I told her, yeah, I went to the gym this morning, but nothing different of what my routine is. And I went to treatment.
Mhm.
The doctor told me that I must stop eating like junk food, all the salt, and also stop smoking. Actually, I don't smoke usually, sometimes, and stop drinking alcohol and change my lifestyle. So that's why I say that that's the most important treatment. After that, we should look for medical treatment, let's say medicines. Uh, we usually use losartan here. That
Or
is, I
enalapril,
think,
right?
yeah, those are the most common.
Yeah.
I prefer losartan because I think it's better, but it depends in the case
Mhm.
of the patient too, how the treatment, how the does does that treatment accomplishes the patient's condition. Also see underlying stuff like diabetes or obesity. Everything comes together.
Okay. Okay. Yes, I have a lot of patients. Usually, most of my patients has this treatment with enalapril or losartan,
Yeah,
like candies,
yeah, yeah.
almost every day.
Yeah, they have to take care with it, because sometimes when, for example, my mom, she has high blood pressure, and she used to take one pill in the morning and another one at night, and she started feeling like low blood pressure, because she changed a lot of her lifestyle too. And I told her to stop taking one and only take the morning one, and it was great. It was good. So
Oh.
she continued with a half treatment. Instead of taking two pills, she just took one.
Okay, so there is a chance that maybe a patient could recover
Of
at
course,
all
yeah, I think so.
and never has to take again those pills.
I don't think so. I don't think that never stop taking the pills, but lowering the dose. Yes, lowering the dose, changing your lifestyle.
Okay. Okay, perfect. And remember that we were talking about the physical examination, right?
Yes.
Please,
Sorry.
I want you to describe maybe the whole procedure.
Okay,
Okay.
physical examination is really important. We start with this inspection, because I think it's a must to first see everything of the patient, how he or she talks, the way of walking, like have a glance of everything. After that, never forget to do them. In this case, we start with inspection. After that, we go with auscultation, with a percussion, and finally with a palpation. But actually, I think I'm missing. I'm changing the orders. I'm really focused on other things, so I'm forgetting some stuff about it, about
No, no problem.
interacting with patients. Yeah, but well, physical examination is a must always, and it's something that I can say that is good in our cases in Bolivia, for example, because when I was in the US, physicians, especially the ones that have a specialty and a subspecialty, don't even touch patients. They just see their MRI, and they tell them what to do. They don't inspect the patients. They don't ask them anything. We are very used, I think, at all levels, specialists, non-specialists, to see the patient, to talk about her problems, to inspect, to do the palpation, to, I don't know, percussion, everything. But there is really something that I think they have a lack of
Yeah.
clinical medicine. Yeah,
Yeah, you have to make the anamnesis and
yeah,
everything, right?
always. Yes.
So important. Okay. Okay. Jorge, thank you so much.
Oh, thank you.
And remember that we have the replacement on Monday at
Sure.
9:30.
9:30.
Okay.
Okay.
Yes, I will send to you my questionnaire, please.
Okay.
And
Sorry.
no problem. Are you coughing? Are you with
Yeah, but I'm feeling
what
better.
happened with you?
I'm feeling better. I think on Tuesday I
Okay.
was like almost dying, but now I'm feeling better.
Oh no. Yeah, I was like that 2 weeks ago. I had
Oh,
COVID.
really? Oh my
Yeah,
gosh. But
but
was
it
it good?
was.
Was it okay?
I felt so bad. It was the second time, but I felt uh, worse than the first one, but not that worse. I'm still here, so
Yeah,
I
that's the
think
important thing. Yeah, you're getting
that's the
stronger,
important
so
thing.
no problem.
Yeah, but I'm losing hair,
Oh,
and
really?
yeah, and I cannot smell so well. But I
It
think with
happens.
time, right?
Yeah,
Yeah,
do something to maybe, I don't know, to take some stimulus to,
cafe.
yeah, maybe coffee or that stuff.
Yeah,
Okay, thank you.
yeah. Okay, thank you.
Good
Take
night.
care. Bye, Jorge. Good night. Hi, Jethro. Good night. Can you listen to me?
Yes, teacher, I can listen to you. Good evening.
Good evening. How are you?
I'm tired, but I'm okay, thanks.
Why are you tired? I'm tired too.
Studying, teacher. I'm studying my books of medicine.
Okay, yeah. We have days and days, right?
Yeah.
Okay, Jethro. Remember we were talking about circulation.
Yes.
Uh, what can you tell me about high blood pressure?
Okay. I think this is the more common disease, and not just in Bolivia, and not just in all the world. I think the people really don't really um I think it's very common and the population. Actually, I have this condition, and
Have it?
yeah,
That you are so young to have it, but it's
I know,
why is
and
that?
because I'm a person of health, and that's the worst of this.
Oh,
But
okay, is that hereditary?
no, no, maybe en
Mhm.
¿cómo se llama? Mayoría de los casos, what is the word?
What is the word are you looking for?
Mm, The most of cases in this disease is for comida chatarra, no sé cómo se dice. Teacher.
Junk food.
Y malos hábitos.
Junk food.
Um,
Jethro, can you listen to me?
teacher,
Hi. Jethro, I think I'm losing you. Can you listen to me?
yes, teacher. Not well,
Okay,
but
junk food is the word you're looking for.
okay, teacher. Thanks. But in most of cases in the disease, it's bad eating habits. with a person like me have in these cases for this condition. But in the less of cases, menos minoría de casos,
In most cases,
no, en más pequeño, la minoría de los casos,
less
sí,
less cases.
exactly, the less cases, it's yes, it's hereditary, but in the most cases, it's bad habits, junk food, and people you don't have the habit to do exercise, walking, running, and this is the most common in the most of cases. And this disease have very have ¿cómo? Affect- affect-
Affects
yes, affect the other organs like kidneys, maybe brain, and actually the circulation too, and the heart, and more different organs. Not just hey, I have a high blood pressure, and that's all. No, affects to another organs of the body.
okay. Okay, Jethro. And how would you manage the treatment of this condition?
Okay, what I learned in my career is three ¿cómo sería? Tres pilares, no, pillars, no.
Three steps?
Yeah, 3 steps. Like one,
Three fundamental steps. Three fundamental steps, let's say.
okay, yes, thanks so much. 3 fundamental steps like exercise, change bad habits like the food and everything, and obviously medicamentos, los medicamentos, medicines, igual, ¿no?
Drugs or medicines?
Yeah, this three is the more important for treatment for this disease. Exercise, take out the bad habits like food, and if this is necessary, use a medicine.
Okay.
It's important to talk to the patient and concientizar, no sé cómo se dice esa palabra.
Make the patient conscious that he has to change his lifestyle.
Exactly. I think this one, thanks so much, teacher. This one is the more important in the cases. The patient knows, understand what he have a high blood pressure, and maybe there's not really a just this, and high blood pressure, have can affect the kidneys, brain, and circulation, and all this is very dangerous for the body. You need to
Okay.
change lifestyle.
Okay. And well, how high is your blood pressure, Jethro? How high is your blood pressure? Your levels?
Limit is 100.
I want to know.
It's 150.
No, please. 150?
No,
Jethro, you have to stop.
140. Sistólica, no sé cómo se dice sistólica.
Systolic
Systolic and
diastolic.
diastolic 90.
Wow, it's high. Well, you have a range of 10 plus 10 or less 10, right?
Yeah.
But you're over that. So you have to stop eating junk food. Do you drink?
No, I don't drink.
Do you smoke?
No, don't smoke too.
You're lying.
Really, I don't like it. I don't like
Okay. Okay, maybe junk food. Stop with the junk food and make some exercise, right?
Cochabamba. It's not easy, but
Oh, that's why. It
Cochabamba.
explains everything to me. Okay, yeah. Okay, Pedro. You have to take care of yourself. Okay. Well, can you name and explain another circulation disease?
Teacher, can you repeat, please?
Yes. Can you name and explain another circulation disease?
Yes, and maybe like I don't know how to say injury kidney,
Okay. Injury of kidney. Yeah.
injury of kidney, or maybe the most common is the I don't know the same injury of heart. I don't know. No me acuerdo. Insuficiencia cardíaca, no sé cómo se dice.
Heart disease. What do you want to say in
Ah,
Spanish?
insuficiencia cardíaca.
Heart insufficiency.
Heart insufficiency may be the most common. It can affect
Okay.
in this condition because the patients or the patient who have bad habits and with the food maybe not just have hyperplasias, have high cholesterol, and this one have really affect the heart and maybe cause a lot of problems like fibrilación.
The relation, I think. I will look for. Just a second. Okay, continue.
And I think this one is the most dangerous. And like another organ of the body can affect is really is the kidney. Like I don't remember if it's kind of cause on I mean, en español se dice insuficiencia hay renal y posrenal.
Okay. Kidney insufficiency.
Yes, teacher, but estoy buscando es el que dice prerenal, renal y posrenal. Son tres situaciones que se puede decir. Y no
Okay. I never heard about that, but let's look for that. Okay. Okay. Continue explaining to me.
okay. Like I say, this type of patient who have effect with this disease, está acompañado, se acompaña de
It comes with, or it goes with?
exactly. It comes with high cholesterol and triglycerides. I don't know how to say in English.
Triglycerides.
Triglycerides. And this one really affects the heart. Another like is like lipoproteínas. No sé cómo se dice.
Lipoproteins.
Lipoproteins like
Or lipoproteins, sorry.
lipoproteins. And I think that's all.
Okay. And well, remember that we were talking examination, right? Could you please describe this the physical examination in general?
And
The
thorax
steps of a physical examination.
and heart auscultation, right?
Yes. auscultation, palpation, and those things.
The steps, first one, I think is inspection, how you can see the chest, the patient, if he have or she have, no sé cómo se dice en inglés, tórax carinatum, excavatum, se llama, ¿no? Una depresión o una embombado el pecho del paciente.
Okay, try to describe, because you can say when the thorax has a depression. Yeah.
Tórax excavatum. We can see the
Okay.
tórax, esternón. No sé cómo se dice, esternón. I don't know. It's the
Oh.
bone, esternón.
Yeah.
We have maybe and the can see a depression, and this you can see an infection. The another one is you can see the auscultation. It's a four. No, I don't know how to say in English, but aórtico tricuspidio mitral son the focus. Focus
Aortic tricuspid mitral.
Yeah, es ¿cómo se llama? Focus de auscultación. No, I don't know how to say in English. Focus de auscultación.
Okay, you can describe it and try to say another words. Like, for example, make the auscultation in some specific areas.
Yeah, I think we'll see in the class, but I can't remember now. That it's auscultation. Like another one is palpation. I think is the complement with the inspection. Because if the patient have depression, something you can feel it with your hands and then the chest of the patient.
Mm-hmm.
The last one is percussion. And I think maybe if the patient have like I don't know how to say in English, hemothorax.
Pneumothorax.
Sí, no, el hemotórax, teacher, con sangre. El neumotórax con aire, hemotórax con sangre. Y
Okay, I hear.
You can sentir como sería un sonido como, ¿cómo se llama?
Hemothorax is the same. Hemothorax or pneumothorax is the same. It keeps its forms. Okay. And oh, okay, Jethro, we don't have so much time, but I ask you, please, to fill my questionnaire before you go. And Jethro, remember we have classes on Monday after our theoretical class, right? At 10:15 with you.
Exactly.
Okay, don't go. I will take a picture. Hey, Ale. Just a second, just a second. Okay. She escapes. Okay. Thank you so much, Jethro. Have a good night and see you on Monday.
Teacher, thank you. Bye.
Thank you. Take care. Bye-bye. Hi, Ale. Good evening.
Hi, teacher. Good night.
How are you?
Oh, it's great for the moment.
Okay. Ale, what can you tell me about high blood pressure? Tell me everything you want about high blood pressure.
High normal person?
High blood pressure.
Okay.
Sorry.
Well, it's a part of the vital signs, and it's a very important part. The normal question is to 90. Sorry. Yes. 90 for the diastolic and 120 for the systolic, but not all the patients have that kind of pressure. Maybe 110, 100, 100 or 90, it's okay. The less pressure, acceptable pressure is 60 for the diastolic and 90 for the systolic. In patients with high pressure, maybe 140 for the systolic and 90 for the diastolic. And we have to check in patients when have a high pressure, we have to valorar.
We have to valorate.
We had to valorate in 15 years for have a diagnostic with high pressure. Sometimes the patients don't like the hospitals or have fear, the hospital have fear with the doctors. When we take depression, maybe it's high, but it's not a pathology.
Mhm.
It's for the fear at the moment.
Okay, so you're saying that you have to prevent since people has 15 years old? Yeah.
No. For the diagnostic, we can say this patient have high pressure just with one. If we just take one time the pressure, we
Oh,
need
okay.
take the pressure 2 times,
Okay.
and right now and in 15 days.
Okay. So it's not it won't be the same level pressure if you took it on at in the morning or at night. It can vary.
Not much for the pressure, no. For other thing, yes, or maybe after eat, when the patient eat maybe a lot of salty food, but we didn't see that clinically. Sometimes article says the coffee maybe can have a high pressure before you take it, but other article says no. And I did it's not a thesis, but it's a work about that. When
An investigation.
Yes, and I didn't see real change about the coffee and the pressure. It's not a relevant change.
Okay. So how would you manage this condition with the treatment?
Can you repeat, please?
Yes.
Could you one more time?
How would you manage the treatment in this condition?
Okay, we have the pharmacologic treatment and the non-pharmacologic treatment. About the non-pharmacologic, we have to be carefully with the food. The patient can eat a lot of salty food, and not much sodas or coffee. But the principle is the salty food. We come to restrict this kind of food, and the patient have to do exercise. I read in an article 6 days in a week for just 1 hour, and that's a great factor for don't take a pharmacologic
Treatment. Okay, so you're saying that we have to make 6 days in a week exercises, 1 hour each day.
Yes,
Oh my God.
it's a lot. Yes.
Yeah, but it's healthy, right? Even for
Yes.
another diseases, not only high blood pressure, but we are a little bit lazy here.
Yeah, it's not a easy thing, but with 10 minutes day,
I think it's okay.
no, it's okay. Yeah,
Okay, I will take your advice and I will do it.
I don't.
Just 10 minutes.
Yeah, it's great.
But it has to
You
be intense.
feel great. Your body feel great. It's it's the best option for be healthy.
Yes, I agree with you. Okay. Okay, Ale. On the other hand, we were talking about examination, a physical examination. Can you describe a physical examination in your experience?
Okay, the physical examination about the heart, we can see the
Whatever you want.
all the body. Okay, because we can see the edema in lower limbs. We can see the jugular is not ingurgitation. What's the correct word? Or is ingurgitation?
No, I think it's another word. I told you last class, I forgot it too.
Sorry.
No problem. Okay, go ahead and I will tell you in a minute.
Sometimes we can see the cyanotic phase, or edema,
And gore.
engorge. Yes, engorge, jugular engorge.
Okay.
Edema on the face. We about the physical examination about the thorax. We can see sometimes in some patients scars for some chirurgic treatment are abnormalities of the thorax, like pectum excavatum.
Abnormal. Yeah.
Abnormal. Okay. Abnormal chest or thorax. About the auscultation, maybe is the first step for evaluate the heart, and we can focus for one valve. about mitral valve, spiral valve, pulmonary, or aortic. And we can listen the characteristic of the beat, if it's fast or no. Maybe the patient have a tachycardia or
Tachycard
bradycardia.
or
Tachycard?
bradycard. Tachycard or bradycard.
Okay, tachycard or bradycard. Maybe if the patient have arrhythmia
Mhm.
or some murmur.
Murmurs. Mhm.
Okay, murmurs.
Okay, Ale. That was good. Very
Okay,
complete.
Yeah.
Go ahead.
No, that's all. I can see the questionnaire.
Oh,
I
yes, please. That's
Okay.
what I was. Please fill it for me and I will take a picture. Okay.
Okay. It's done, teacher.
Thank you. Remember on Monday, we have to replace our first practical class at 10 with you. Okay. After the
Yes.
theoretical class.
It's about the first topic, right?
Yes. I will put it on the group so you can remember and maybe talk about or learn more or practice. Okay.
Okay.
But yes, it's
Okay.
about the first class. Okay,
Yeah.
thank you so much, Ale, and see you on Monday at 8 for the theoretical class and then 10.
Yes. Okay. Thank you, teacher.
Okay,
Have a good night.
thank you. Take care, you too. Bye-bye.
Bye.
Bye. Hi, Carla. Good evening. Can you listen to me? Okay. Now, hi, Carla. Good evening. Can you listen to me now?
Good evening, Miss.
Yes, I can listen to you.
Sorry, I have problems with my Wi-Fi and I had
Mm,
to connect
No
with
worries.
my cell phone.
No worries. So can you put on your camera or no?
Okay, yes, but I have to. One moment, please.
Of course, if you have any trouble with your connection and you have to turn off your camera, it's okay. But
Okay.
we can start.
Okay.
Okay,
Thank you.
Carlita, remember we were talking about circulation, right?
Yeah.
Yesterday. So what could you tell me about high blood pressure? Everything you can tell me about this condition, please.
Okay. High blood pressure. I think that it's one of the most common disease in the world. It it happens when the force of the blood against the walls of arteries is high. It could maybe classified in primary hypertension and secondary hypertension. In primary hypertension, we can, well, it is also called essential, hipertensión esencial, because there is not a specific cause, but we can have risk factors would be like the old people, obesity, bad eating habits would be. And it also have has a genetic factor. Yes, I think that. I don't know what what more to say. Excuse me, Miss. I'm not listening to you. I don't listen.
I was mute. Sorry.
Okay. No.
I was telling you that how would you manage the treatment for this condition?
Treatment. Okay, treatment will be first there are medication and also change the how can I say estilo de vida?
Lifestyle.
Lifestyle. Also that do more exercise. Also the eating habits have to have better, and it depends. It depends of the person, what kind of condition the person has. And yes, I think that.
Okay. So you will, of course, it depends on the characteristics of the patient, but what is the first thing you do? You said try with natural things, right? And things that can change the patient, like habits, like his lifestyle, for example, and all this stuff. And then what if it doesn't work?
Okay, it depends how high is the pressure. we can use
Medication or drugs?
medication or drugs like
Enalapril.
enalapril, atenolol, or there are different. We have to, we can generalize all the patient. We can see other factors the patient has. So it depends, I think.
Okay. Okay, that's good.
Mhm.
I agree with you. You have to check your patients, make a good diagnosis, and then prepare a treatment for this specific patient, right?
Yes.
Perfect. Can you describe or name and explain another circulation disease?
Okay. We could have cardiac arrhythmias.
Okay, go ahead.
One of the most common is atrial arrhythmia. It's atrial fibrillation will be fibrilación auricular.
Auricular fibrillation.
Will be, pero in Spanish we also use the term fibrilación atrial.
Atrial.
Will be?
Yes,
Okay.
atrial fibrillation. It's the same.
It's the same. Or auricular fibrillation, right? Okay.
Yes.
Yeah, this is when the it's an irregular I don't know what to say.
Functioning.
Excuse me?
It's an irregular functioning. Like
yes, of the
okay.
Yes, when the how can I say frecuencia cardíaca?
Cardiac frequency.
Cardiac frequency is not regular. We can have it can variate.
Yes, it can vary.
It can vary much, and the symptoms could be dyspnea, could be also fatigue, maybe debility, and we can diagnose this
diagnose
in
yes
electrocardiogram.
The electrocardiogram, we can diagnose with the electrocardiogram.
Diagnose.
Or ECT. Right? Yes, diagnose. Or you can say the ECT.
ECT. Yeah, right. It's the it's like to say gold standard to diagnostic this disease. And well, we can use also here drugs like it depends, as I said in the other case, we can use most of the time digoxina maybe. And if it is acompañado, how can I say?
You can say it goes with, or it comes with.
And it comes with high blood pressure, because high blood pressure can be a factor risk to have this atrial fibrillation. So we can tenemos que manejar.
We have to manage.
To manage all the disease that the patient have. Yes, I think that.
Okay, that was good. And while I'm sending to you my questionnaire, please, I will ask you to describe the physical examination. as you know, we were talking about yesterday, it has steps. So in your experience, how would you make a physical examination of every single part? I don't know. It depends on you.
Okay, we have to, well, we have inspection. The first is always is inspection. We have to see the patient since they enter to the door. We have to see the fascia. Me.
I'm still here. Sorry. I don't know what happened with this.
Don't worry.
I'm just keeping and take a screenshot and it doesn't work. Sorry.
Don't worry. Thank you.
Carlita.
I think that we can see the fascia, the patient. Also we can see the way they walks. The way they walk. Most of the time, or many times, they came with pain. It depends the pain. Where is the pain? They could come with how can I say agachados?
You can say, I forgot the word, but let me check. Okay,
Thank you.
continue.
I can, okay. And also, yes, this is in the inspection, and it depends what disease they have. We can also, if they have lung disease, we can auscultate the lungs and hear ruido extraño, strange.
Yes, strange murmur or sound, maybe.
Yes, and also we can palpate, like in gastrointestinal disease, we can palpate the abdomen. Is that correct to say abdomen in English?
Abdomen.
Abdomen. Okay, thank you. First, we have to listen, because when we palpate or percutir, I don't know how to say percutir.
Percussion.
We can alterate if we listen after we percussion.
After we make percussion. Oh,
Yes.
after we percut.
Yes, I think that, and it also, okay. Yes.
Okay. Okay, Carlita, it was good. It's just a thing to practice, but you understand everything. You have new vocabulary, and a word that we will learn maybe on the next classes. It's tilt. Okay, it's tilt. I will write it down. Tilt.
Okay, thank you.
That's the word I was looking for inclination.
Okay, thank you, Miss. Tilt.
Yes. Okay. Okay, Carlita. Remember that on Monday we have to replace the first practical class with you at 10:30. Okay.
30 is not 45, I think. With 30?
Yes, because Jethro will be 10:15. You are the last one, 10:30.
Okay.
There's no anyone else. Okay?
Okay, it's okay.
Okay. See you Monday then, and have a good night.
Thank you, Miss. You too.
Bye-bye.
Bye.
Hi, Vale. Good evening.
Good evening, teacher. How are you?
I'm pretty fine. It's a little bit cold here, but fine. How are you?
Yeah, also good. And yeah, it's really cold. This year, I think it's the coldest that I
Yeah.
live, sincerely.
Yeah, that's right. I think the same. But early days were worse. I think it's getting better. I don't know, but
Yeah, yeah, me too,
it is
me
still
too.
cold.
Yeah, like days before, it's you have to use like I don't know, two jackets or three. Now you can go with only one, and it's okay.
Yeah. Instead of two, we can use just one, but we still
It's
use jackets.
progress. Yeah.
The best thing. Okay, Vale. We were talking about yesterday about circulation, right? So I want you to tell me everything you know about high blood pressure.
Well, high blood pressure, it's something really important those days or these days because it's a illness that is really present, not only here. I think in all the world, all around the world, it's really present, and also I think it's a risk factor for other. It's considered one of the risk factor more important, like diabetes, obesity, high blood pressure, and I don't remember, but I think it's for sickness, for illness, that if you combine the four, it's considered like metabolic syndrome.
Oh,
Yes.
okay.
Also, high blood pressure is all bueno, not all, but most of the person that has diabetes also has high blood pressure because it's like they are together. I don't know why. Talking about high blood pressure, it's really important to have a treatment in the beginner, and you have to follow the treatment, because if you don't follow the treatment, the complication of high blood pressure, it could be damage in the brain, also can affect the eyes, also can affect the kidneys, and also can affect eyes, kidneys, also the heart, because it can produce a failure heart, the failure of the heart failure. Yeah. So yeah, it's really important.
Okay. What are the ranges that are normal, and in what
Well,
conditions?
here in Bolivia, that we are in more altitude, the normal is 120 the systolic pressure and 80 diastolic, but it could be plus less 10 meters of mercury.
Let me check this out. You still
Millimeters of mercury. Well,
yeah,
120 80 plus less 10. For example, in young people, the normal is 110 slash 70. And you can say that it could be like pre-high blood pressure when it's more than 130, 85. And you are talking about high blood pressure when it's more than 140, the systolic, and 90, the diastolic. But the point of how you diagnostic the high blood pressure is important, not because, for example, today I take the blood pressure and your blood pressure is 145 95. I cannot say, oh no, you have high blood pressure. No, you have to be really care to taking the blood pressure to diagnostic that the person has high blood pressure. It's really important the way that you take the blood pressure, and also to diagnostic you must take 5 days at the same time, and also the person have to be sit down, and you have to wait like 5 minutes that the person is really calm, and then you can take the blood pressure. Because when you are tired or when you run, all is your heart, when the rhythm or the heart rhythm is accelerate. But no, it's not because the person has tachycardia, that the beat of their heart, it's really fast, not because it's a problem, it's because the
Yes, that's
person
good.
ran, or it's like something physiological, like a physiological physiological tachycardia.
Logical.
Exactly.
Okay.
So that's why it's
Okay.
really important the way that you are diagnostic, the way that you take the blood pressure to diagnostic the high blood pressure. Yes.
To diagnose.
Yeah, sorry, to diagnose.
Pretty much good. It was really understandable. So that's okay. Just a thing.
Thank you.
Pronunciation. Okay. And Vale, how would you manage the treatment of this condition?
Well, the manage of this of the high blood pressure, it's like you can. I think it depends how much is the pressure, because if it's like 135, 34, it's not too high. So it's more like the diet that has the person, that it has to be less salt or salty food. Also, the person has to drink more water. And talking about the drugs, you can use the drugs that help you expulse more liquid.
Okay.
Diuretics.
Yeah.
Exactly. But if you're talking about a person that has high blood pressure, like 140, you must use the drugs that help to less the blood pressure. Like the famous one here is losartan or enalapril.
Yes. Like candies, right?
Exactly. That are drugs that they work in the system that regulate the blood pressure. Also, that it has to be like pharmacology treatment with the diet, and also the person has to eat well, and also do a little bit exercise. Are really important. Not only say, I drink or I take losartan, so okay, it's fine. Not because if the person take the pill and the diet it's really bad, it will not help. So instead of take only one tablet, the person has to take two. And the treatment will be with more pills. And okay, it would help, but in the time they will have problems with the liver, because all the tablets that you take pass with it has like the stop in the liver, all the pills. So you have to also think about that, because in the future you will have your problem about the high blood pressure and then a problem with your liver.
Yes, even with your kidney, right?
Exactly.
Okay, so that's how you have to explain to your patients.
Thank you.
Okay.
And also you have to explain the way to take the pill. For example, when you take omeprazole,
Mhm.
that protect the stomach, you have
Yes.
to say it has to be before the breakfast. No,
Yes,
after, before breakfast.
for.
And
And
then
I'm sorry. And how much time you have to wait before you take the other pill?
mm, uh, I think it depends. I know the doctors that say you eat, you wait like 10 minutes, and then
Mhm.
you drink or you take the tablet. I know other doctors that say you eat, and then you have to wait like 1 hour, and then you take the tablet. But I think um it doesn't matter, but you have to like respect the schedule that you have, because
Mhm.
it's not about the eat or not you eat or not eat like 10 or half hour before the tablet. I think it depends, because when you eat and when your stomach is full, then like I don't know how to say, but the pyloro, the like the door that is between stomach and the
Stomach.
low stomach and the low intestine
Mhm.
open, then all the food goes. And if you have the pill, it will go also together. So it will be the absorption, it will be faster, I think, if I'm not
Okay.
wrong.
So let me check. The omeprazole
The omeprazole, it's
supremes.
before.
Yeah, but it supremes the gastric juice, right?
It depends which one, because you have like two kind of medicine, two kind of drugs, but the really point of these are to protect the stomach.
Okay.
That's why you have to take it before the foods and before everything.
Okay, Vale. Thank you so much. Can you
No, thank you to
watch
you.
my
Yeah,
questionnaire?
I already feel it and send to you.
Okay. Take a little picture and then I'll let you rest. Wait,
Okay,
wait.
thank you.
Again?
Okay, see you on Monday.
Yes, but let me remind you that you have to, we have the replacement on Monday. Oh no, Vale, you weren't here. So we have a schedule for 9:45 for Wednesday.
Okay.
Do you have time? It's okay for
Yeah,
you?
it's really okay. 9:45.
Okay, Vale. So I will remind you again, but see you on Monday, okay? Bye-bye. Hi, Carlita. Good evening.
Hi, how are you?
I'm pretty fine, thank you. It's a little bit cold here, but I'm good.
Ah, here too.
Yeah?
Look, my sweater.
Yeah. We're like bears.
Yeah,
Okay,
here
Carlita.
in Cuenca, in the city that I live, it have been raining
Raining?
raining too much.
Oh.
So the rivers are, ¿cómo se dice? Desbordamiento.
Um, well, they were full, and so
Yeah,
let me check.
so it's It's really cold. It's raining all day.
Wow. But it's
Yeah.
not dangerous that
Oh.
the
And here in
rivers
Cuenca,
go.
we have 4 rivers. So,
Oh,
so you have bridges all the
yeah.
time. So it's a
Wow.
little dangerous.
Overflows.
Overflows.
Yes. Okay. Well, remember we were talking about circulation, right?
Yeah.
I want you to tell me, please, everything you can about high blood pressure.
About high blood pressure. Okay. High blood pressure is the elevation of the, how do you say, cifras?
The ranges in this
The
case,
ranges of systolic and diastolic pressure over 140 systolic pressure and 90 diastolic pressure. So the hypertension does not have a cause. Maybe some risk factors like how do you say hereditario?
hereditary.
Hereditary, like hereditary and some others like your lifestyle, like overweight, bad alimentation, this loss of activity, this sedentarism. I don't know.
Sedentarism, yes.
Yeah, this is maybe the causes. So hypertension is called like the silence disease because
Yeah.
it does not have a symptomatic a specific symptomatic. I don't know how to say it. Symptoms specific or symptomatic symptoms. So let me. Sorry. So it is called like that because you don't have these specific symptoms, but you can diagnose hypertension in some medical appointment. Some people has or had a headache. Some people had how do you say hemorrhagia? Hemorrhage, and some people had other signs like hemorrhage in the eye. I don't know how to say that.
Okay. Eye hemorrhage.
Eye hemorrhage, and I think that. And the treatment includes the first step is to change your lifestyle, have a good alimentation, make some activity, and you have to take your pressure every day in 2 times in the day for a week. And if your lifestyle don't change, or even if you change your lifestyle and your ranges of blood pressure doesn't change, you have to take medication. So there's a lot of medication you could have for this disease, but I think the most important thing are the complications or in hypertension, like strokes.
Okay.
I don't know how to say this, evento cerebrovascular, pero hemorrágico, porque el isquémico es el stroke, pero el hemorrágico no sé cómo se dice.
Evento
Ah.
cerrado.
Evento cerebral hemorrágico.
Okay.
Sí, y kidney failure
Yeah.
is one of the complications most important. And obviously, complications in your heart, like this kind of arrhythmias.
Mhm.
I think that's it.
Okay. Okay, Carlita. We were talking about with your classmates the omeprazole. I don't know. What is the function of this this
I don't
thing?
know how to say this in
I
English.
thought, now you can. I thought that it supremes the gastric jolts, right? But I don't know if it's real.
Omeprazole blocks or inhibit, ¿cómo se dice?
Inhibits.
Inhibits. It calls proton bombs.
Okay.
And which that do is that your stomach don't produce this gastric fluid in much. I don't know how to say. Estoy un poco bloqueada hoy día. Pero,
I understand.
Yes, and it would calm your burn in the stomach.
Yeah.
But the function or the function of this drug is that don't produce too much gastric fluid
Okay.
by this inhibition of the proton bombs.
Okay. So I was thinking, well, and that's the way it protects your stomach, right?
Yeah.
Okay, perfect. Thank you. Thank you so much.
Hoy estoy un poco bloqueada, no sé por qué estoy así.
No worries. There are times. There are times.
Okay, so that's all?
No, you have to pick one more disease, okay? And I'll let you sleep, I swear. Explain and tell me about one more circulation disease.
Circulation disease. I think heart failure is one of the most important circulation disease because it's a complication of hypertension, diabetes, and obesity. So, well, there's other causes, but I think all these diseases that can cause heart failure are preventable. It's okay, that word?
Preventive. Yeah, preventable. It's okay.
Yeah. You can prevent obesity, you can prevent diabetes, you can prevent hypertension, but if you prevent those diseases, you can prevent heart failure. So heart failure is a consequence of some disease. It's always a consequence. And it could cost a lot of money if you don't have a good seguro?
Insurance.
A good insurance. A good notice here in Ecuador is that you have public health is free for everyone, even if you're not Ecuadorian. So you have access. Yeah, here we have people from Venezuela, from United States that goes to the public health, and they can have any treatment they need.
Wow, that's really good. I will go to. I will go there.
Yeah, here is free, but you know, it's not free at all. We have
Of
to
course.
pay taxes. We have all those things, and after this COVID pandemic, we have really difficulties here with our health system. So now the president called for an emergency with the public health. So which is free is not always free. And I think that people may understand how's the cost of those diseases, because here we don't have anything. We don't have medicines. We don't have nothing now. But I think that if you can make conciencia, make conscious.
You can get conscious.
Yeah, if you can get conscious of the price of those diseases, I think that people would have a better lifestyle.
Yeah, that's why people are having trouble in Ecuador.
Yeah, we have a protest.
Protests.
Yeah, for 18 days.
Yeah, I saw it.
Yeah, and one of the points that the people are asking the government are to reforzar, to get more strong, I don't know, the public health system. So that's it. I think medicine goes for more. It's not only the disease now, it's the health.
But it I don't know, the price you have to pay for taxes are so high now, or not?
Well, with our new president, yeah, we have over $5,000 you have to pay taxes. So here in Ecuador, the basic salary is almost 500, sorry. So most of the people earns it's okay.
Yeah. Thank you.
Earns 1,000 and more. So I think to 2023 we have to pay taxes all.
Yes, I think it's a good amount, right? Everyone can live a good life. Not maybe not the best one that you want, but yeah, that's so good. Here we don't have that chances.
Yeah.
So it's so low. That's we have the SUS, the universal insurance, but it doesn't work like we think now.
But you have to pay for those services.
I don't know. I never been there. I never asked.
Really?
Yeah, maybe the basic drugs. You don't have to pay the basic drugs and the basic treatments, but I don't know about the others. I will ask about it.
Wow. Well, here in Ecuador, all the people once in your life goes to the public health system. No, it's very different. I think that it's good, but have a high price for the people that have to pay taxes, which I think poor people don't have to pay taxes, and the rich people evades taxes. So resta tenemos que pagar.
In every single country.
Yeah.
Okay, Carlita, thank you so much. Carla, we have the replacement on Monday, remember? At 9:15 with you, okay?
Yeah, we have some topics I would like to read. Today I feel so blackout.
Okay, no worries. I will send to you just to remember maybe the link of the class, okay? And I will tell you what was about. Maybe I don't know, maybe the record and my slides, okay?
Okay, so I would like to read something more to get some more, no sé, un mejor lenguaje. Siento que estoy bloqueada, que no puedo conectar bien.
No worries. I'm still looking for a podcast so you can listen.
Yeah,
To repeat, I told you last class, and I'm still working on that. Okay, I will find out and I will give you
yeah,
by the group.
please.
Okay,
Thank
no
you.
worries. Take care and see you Monday. Have a good night.
Have a good night. Bye
Bye
bye.
bye. Jocelyn, are you here?
Good evening, teacher.
Good evening, Jocelyn. Can you turn on your camera?
Okay, teacher.
Just give me a second. Can you listen to me now?
Teacher?
Can you listen to me now?
Yes, teacher. Pero
Okay.
algo bajito.
Oh no. I will I will do something. Maybe this. Oh, can you listen to me now? Better?
Ahora un poco mejor, teacher.
Okay. Okay. Okay, I hope you can listen to me well now. But Jocelyn, can you tell me about high blood pressure? This condition?
Okay.
Tell me everything you know about high blood pressure, okay?
Okay, teacher. Sería a blood pressure. Blood pressure is high. Blood pressure is high. Blood. Blood pressure.
Blood, remember. Yo sé
Blood.
que cuando aprendemos inglés nos dicen que es la doble O, es como U, pero en este caso es blood, ¿ok? High blood pressure.
Blood. Okay. Blood pressure is when blood pressure rise above 100 14 100, ¿cómo se dice, teacher? 114
40.
40.
14 es 14. 40,
40.
40.
40. ¿Cómo puedo decir lo que le divide en
Slash.
600
Barra o slash.
slash 90
Ujú.
slash Slide 90. A ver, más que nos podría decir. Sería, ya. Have symptoms. Have symptoms. Have symptoms. Shoes. Cefalia, ¿cómo era? Head, head, head,
Headache.
headache, headache. Headache. Después, cefalea. Pain, ellas, o ellas, pain, ella, pain.
Eyes.
Ajá. Dolor
Okay.
en los ojos.
Remember, eyes. Okay. The pronunciation. No te olvides pronunciar. La pronunciación es bien importante para que no te entiendan otra cosa. Okay. Pain, eyes. Or pain on the eyes.
Yes. Ok. Pain on después, a ver. Los ojos. ¿Qué es esto? Insomnio, insomnia. ¿Cómo se produce insomnio? Insomnia, insomnio, insomnio,
Insomnia.
insomnia. Irritable, irritable,
¿Qué quieres decir?
irritable, irritabilidad,
Irritability.
irritable, ¿qué sería?
What else?
¿Cómo?
What would it be the treatment for this condition?
Se llama esto paracetamol, después antihipertensives,
Antihypertensives.
antihipertensives, antihypertensives, such as losartan.
Okay, like as losartan.
Like losartan. Después sería amlodipino.
Sorry, what was the name?
Amlodipino.
Amlodipino, okay.
Amlodipino. Después atenolol.
Okay. It's a good, it's a proper name, so it's correct. It changes so much.
Atenolol, después carbelidol.
Okay. Well.
¿Cómo diría teacher diuréticos de asa?
Diuretics.
Diuretics. Okay. Diuretics.
Yes. Okay. Another treatment, but drugs. What could it be?
No. Furosemida.
Another, but drugs, not drugs. Another treatment.
Mm,
It's not all about drugs, but right?
mm,
Maybe you can suggest or recommend your patient to make something to improve or not getting worse.
Yeah. I recommendary the patient.
I recommend
I
to my patient.
I recommend my patient training
Mhm.
training dieta
Diet,
diet
diet,
diet mm, ¿cómo se dice esto? Dieta hiposódica, ¿cómo diría teacher? Low,
to eat less salt, comer menos sal,
o sería
or an
come,
hyposodic diet.
diet, hyposodic diet. Me estaba confundiendo. Don't not eat junk food.
Do not eat
Do not eat junk food o comida chatarra. ¿Cómo se dice?
junk food.
Junk food.
No, junk.
Junk.
I
Junk
will
food.
junk food. Here, there you go. Junk food.
Ya. Ya. Ok. Después. ¿Qué más?
Okay, I sent to you my questionnaire while you are still talking. Could you please fill it for me? Okay, Jocelyn, have you watched it again, the class of yesterday?
Yes,
Or-
teacher.
Okay. Okay, continue doing that because you need to practice a lot. Are you friends with Weimar?
Yes, teacher. My friends.
Okay, your friends. So it will be really helpful for both to practice. Okay? Help him. Practice more. Okay, Jocelyn?
Okay, teacher.
Have you done your practice? The one I sent last week?
Las prácticas de la otra semana. ¿Cómo?
Ya. La práctica que he enviado la anterior semana, ¿la hiciste?
Las dos tareas que tenías, los dos cuestionarios, ¿no es?
Sí.
Estaba haciendo, teacher, pero no he terminado. ¿Tengo que enviarte ahorita?
Hasta mañana tienen, de hecho.
Ah,
Pero
sí,
no,
teacher.
no ve, no hasta, no a la última hora, ¿ya? Practiquen, practiquen un montón. Tienen que seguir escuchando. No sé si están escuchando. Voy a mandar igual un podcast, les decía, para que puedan ir escuchando. Vean en YouTube también las canciones para pronunciar mejor.
Sí.
Importante la pronunciación.
Sí, es que se escribe otra clase y se pronuncia otra clase.
Sí, es cierto. Pero te cuento que el español es mucho más difícil de aprender que el inglés. Y tú ya lo sabes. Entonces, el inglés tendría que resultarte más difícil. A todos, en realidad. Pero es solo con práctica. ¿Ya? Vas a mejorar. Pero si practicas más, un poquito más cada vez, De hecho, yo ya te veo con un avance. No es enorme, pero hay avance. Ese,
Teacher,
ese es
y
poco.
una consultita así para mejorar la pronunciación, es que no sé, no me salen las palabras, no puedo, es que no sé, algo, no sé, alguna aplicación, algo.
Voy a buscar una y vamos a ver. Pero hasta mientras, en Google, tú buscas, digamos, qué sé yo, papá, tomate, tomate traducción, digamos, y en Google te lo va a traducir. Y ahí abajito, o sea, te da en español, tú escribes, en inglés te da cómo se escribe. Y como tú no sabes, abajito a la derecha hay una icono de volumen, como el de volumen que tenemos de
Ujú,
sonido,
sí.
ese icono, presionas ahí y va a decirte la correcta pronunciación. Entonces, hasta mientras puedes practicar con eso. Escuchas,
Ah, ya.
escuchas, escuchas y practicas. Pronuncias, escuchas, ya sabes en español, ya sabes en inglés, escuchas, pronuncias. Así, para cada palabra que tú puedas encontrar mientras tanto, ¿ok? Voy a
Ok,
buscar esa aplicación o algo que nos pueda ayudar mejorar, a mejorar el inglés, ¿ya?
ok, teacher, thank you.
Muy bien. You're welcome. Thank you so much. Have a good night. Okay?
Ok,
And
teacher.
see you. Ah, no, espérame. Jocelyn, nosotros tenemos que reponer una clase, la primera práctica, ¿ok? El día miércoles a las 10 de la noche, ¿está bien?
Miércoles 10 de la noche. Sí, está bien, teacher, porque tengo clase justo hasta 9:30. Entonces,
Ok, perfecto.
miércoles 10 de la noche. Muy bien.
Muy bien. Sí, por favor. Igual voy a poner en el grupo para que no se olviden, pero mejor si anotas. Ok, thank you so much. Have a great night and see you on Monday at 8 o'clock. Okay?
Ok.
Okay, bye
Goodbye,
bye.
teacher.
Good night. Take
¿Por qué los Mickey son tan...
Hi, Sergio, can you listen to me? Hello? Hi? Hi. Sergio, can you listen to me?
Good night. Yes, sorry. Yes, I do. Can you hear me?
Yes, now, yes, I know. Now I can hear you. Okay.
Okay, perfect.
Okay,
Sorry, and thank you for.
no worries. We have like 6 minutes. So let's talk about high blood pressure. Everything you can tell me about it. Okay.
Okay, high blood pressure. But the last class we didn't talk about high pressure, right?
Last class,
Or did we?
we talked about yesterday's class. We talked about circulation,
Physical. Yeah, heart and
heart
circulation, right?
problems. Yes. And high blood pressure. I don't know if you want to change the disease.
Okay. It's just I remember more about heart failure that we also talked on the last class. But I mean, it's okay if.
Okay, but go ahead.
Okay. So do I talk about blood pressure or do I talk?
Heart failure, it's okay.
Okay. Oh, well, what I remember about heart failure and how it is related to the terms that we also learned about the shortness of breath that is also called dyspnea, if I
Mhm.
remember correctly. Uh, and in left heart failure, one of the symptoms is shortness of breath. In right heart failure, you can have uh, pudding. It's I think it's pudding edema
Mhm.
that you have. You can also have the jugular vein congestion, peripheral edema, and yeah, that's what I remember right now.
Oh,
What else?
okay, that's good. But there are another diseases related to circulation. Maybe you can keep one or pick up one and explain to me.
Oh, okay, but maybe which one? I don't know if I can tell you more about heart failure or high blood pressure. Maybe I don't know.
Okay, pick. It's on your own.
Okay. Well, blood pressure. If we like just the meaning, the definition would be basically the force of blood on and how it how the blood forces the walls of the arteries and and blood pressure is measured in what you measure in blood pressure is the systolic blood pressure and diastolic blood pressure. What we normally know as normal blood pressure is 120 for systolic blood pressure and 80 for diastolic. Uh, what is considered to be high blood pressure is like from 140 for systolic and 90 for diastolic, and all I mean like from 140 90 and above is considered high blood pressure. um, well, the symptoms of high blood pressure would be headaches, maybe a sensation of the person would start to feel dizzy. Uh, what else? You can also, um, well, high blood pressure can get to a point where it can cause problems in the lungs also. Uh, when when the lungs start to fill with lots of uh, liquid, and it
Mhm.
can also cause many problems. Um, what else? It can also cause symptoms such as shortness of breath, dyspnea. Uh, and I don't know what else I can say about blood pressure
No, it's okay. Maybe the treatment, if you
or the
want.
treatment. The treatment for high blood pressure is based like what's maybe a first line treatment, a second line treatment, and it will depend on maybe the problems you have with your heart after cardiologists study your heart with an EKG, a echocardiogram, and a halter that lasts for 24 hours. After that, they'll decide what kind of problem you can have, and based on that, the patient will receive the treatment. But the treatment for high blood pressure would basically be well, starting from maybe the primary or the basic treatment is changing maybe the lifestyle, which is like decreasing the amount of salt in your diet, uh, not smoking, eating healthy foods, uh, also checking on your blood pressure. If you start to have like symptoms or symptoms that show or indicate that you're not feeling well, or such as a headache, and the the treatment with medication would be the first line would maybe be enalapril or lisinopril, or maybe other types of treatment depending on the kind of, I don't know, heart failure you have, or if it's something that the high blood pressure altered either on your lungs or any other organ. It will depend if you have to reduce the amount of liquid in your organism, or if you have to like control the damage it's having in your heart.
Okay, Sergio, thank you. I don't know if you can see my questionnaire,
Yes, I can.
please. Thank you so much. I know you had trouble with your internet, that's why we have a reduced time. But I remember we had that class that we have to replace, and
Yes.
we will do it on Monday and Wednesday, but Monday is full. And on Wednesday, after the theoretical classes, I have 10:15. I don't know if you're available and you can do it.
Yeah, it's okay. Wednesday at 10:15.
Yes.
Perfect. It's okay. If there's the option of like maybe if my turn can be like earlier, if it's available, I wouldn't have any problem. But it's okay if that's the only hour you can. I have no problem.
Yes. I have this and later, but I think you won't be able, right? Maybe 10:15, please, just this time, and then we will figure it out. Okay?
Perfect. Thank you so much, Ms. Encina.
Thank you. Don't go. I will take a picture. Please,
Okay.
please.
No problem.
Sorry, Weimar. Wait for me. Okay.
Yeah, sorry, babe.
Yeah, I will. Okay. Thank you so much. Have a great night. See you Monday.
Thank you, Mrs. Inez. Good night.
Hi, Weimar. I'm so sorry.
Teacher, good evening, teacher.
Sorry, good evening. I owe you like 4 minutes. Can you open up your camera? Thank you. How is everything? How are you?
I am good, teacher.
Okay, let's start then. We talked about the circulation yesterday, but today I want you to tell me about high blood pressure. Everything you remember about high blood pressure. Do you understand?
Mm, yes, teacher. Yes,
Okay.
he visto el video todo. Sí,
Okay.
sí. Me
Let's
preguntó
talk
sobre
about high. Yes, I'm asking, te estoy preguntando sobre una enfermedad en particular. High blood pressure, presión alta o hipertensión.
Ah, ok, teacher.
Ok.
¿Hago la definición o comento como?
Todo lo que puedas decirme sobre esto.
Ah, ok. Mm, the blood pressure is silent disease. Es o sea, es una enfermedad silenciosa.
Yes, it's okay. Try to say it in English. I understand perfectly. So think in English and say it. Go ahead.
Silent disease and can bring acute complication as hemorrhage, symptoms as dizziness, mareos.
Dizziness. Repeat it.
Dizziness.
Yes. La pronunciación es importante ya.
Okay, teacher.
Primar.
Dizziness, arrhythmia, nausea, nauseous, vomiting, fainting, desmayo,
Fainting. Fainting. Yes.
Fainting.
Yes. Okay.
Síncope, se dice, no creo síncope.
Syncope.
Palpitation. Fatigue.
Okay, those are the most common ones. Esa es la explicación, ¿no es cierto? Y tiene los síntomas más comunes.
Yes, teacher. Sí.
Can you give me the treatment?
In the treatment is antihypertensive as amlodipino, losartan.
Okay. The most common ones, right? I want to, those are the most common ones. Esos son los más comunes. Otro tratamiento que le puedas dar al paciente que no sean medicamentos.
Prevenciones, recomendaciones que
Tell me in English. Recommendations.
Recommendation. Cambios de estilo de vida sería
Change lifestyle.
Change lifestyle.
Again, Change lifestyle.
Change lifestyle.
Style.
Style.
Okay. What else? Change habits.
Mm, ¿Qué más, teacher?
Change habits. Cambio de hábitos.
Ah, change habits. Yeah,
Try to say it.
Delphi diet. Dieta saludable.
Okay. A good, healthy diet.
Healthy diet.
Yes.
Diet. Training, ejercicios. Stop smoking. Stop smoking. Smoking.
Stop smoking.
Decrease sodium in food. En food.
Okay.
Sodium en la comida.
Yes. I understood. Entendí lo que me dijiste. Está bien. Okay. That's good.
Yes.
But I want you to tell me the examination, the physical examination process.
Inspection. Teacher, ¿puedo decir de tórax? Lo que
Yes,
avanzamos.
sir.
Lo que avanzamos.
Yes, yes, of course.
Inspection, type of breathing, frequency.
Breathing. Frequency.
Palpation, elasticity, and expansibility. And percussion.
Percussion.
Percussion. To the percussion and tympanic sound is heard.
Tympanic sound of the heart.
The heart. On auscultation, we can find lungs, pulmones, bronchi, reals, crepitos, crowcols.
Ok. Lo que quiero es que tú me digas lo que tú sabes. Obviamente has aprendido eso, pero tú sabes de un proceso, ¿no es cierto? De 4 pasos. Entonces, eso quiero que tú me expliques, porque yo sé que tú sabes, solo que te está costando traducirlo al inglés. But, Weimar, bueno, ya no tenemos mucho tiempo. De todas formas, está bien, mucho mejor, mucho mejor. Seguí practicando, no te olvides. Y el día miércoles en la noche tenemos el reemplazo de la clase del lunes, del primer lunes, no, perdón, del primer martes de práctica. ¿Te parece el miércoles en la noche? ¿Puedes? A las 10:30 sería tu hora.
Ok, teacher.
¿Estaría bien?
Sí, no problems.
Perfect. Perfect, Weimar. Can you watch my questionnaire?
Solo me falta la segunda, teacher. La segunda para
Ok.
enviar. Lo envío en la mañanita.
Esta de aquí de ahora.
Ah, no, de la tarea, teacher. Hasta mañana tenemos.
Bien, sí, no hay problema. Pero ahora la encuesta, ¿la puedes ver, la de ahora?
Yes, teacher.
¿La puedes llenar, por favor?
Okay, teacher.
Okay, just a picture, okay? One more. Okay, Weimar, thank you so much. And see you on Monday.
Teacher.
Thank you. Take care. Bye-bye.
Goodbye, teacher.
Bye. Hi, Claudia. Good night. I'm so sorry for let you waiting. Can you listen
Hi,
to me?
teacher. Yeah, I can. Don't worry.
Great. Thank you. Okay, can you turn on your camera, please?
Okay.
Thank you so much. Okay, Claudia, remember we were talking about circulation yesterday, but part of it is a topic like high blood pressure. Can you give me a resume of this disease?
Okay. High blood pressure, it's a common disease in most of the people after the 45 years old. It has different ranges, I don't know, of the severe of the hypertension. So year by year after year, it changes the classification. I remember that the last one is that 100, the race over 129, I think. And the systolic pressure and the diastolic pressure over 89. It's name it like pre-hypertension or hypertension in the phase 1. So it has so many causes, I think. Most of the times it depends of the consume of salty meals, I think, that can elevate the blood pressure. Also, it's associated to other diseases like diabetes, I think, like cardiovascular problems also, and brain problems also. But in brain problems is most of like a simple disease is like a symptom. No.
Okay.
So it has a treatment, and the treatment it depends of the stage of the disease. The treatment it depends. For example, we use ARA2. Then the most common drug that people use is losartan, for example. Also,
enalapril.
Enalapril, that it's a kind of YECA, or angiotensin enzyme inhibitor. in the other stage, we can use beta blockants, maybe.
Beta blockers.
Beta blockers, yeah. And when we have an hypertensive urgency, we can use diuretics.
Diuretics.
Diuretics, like furosemida, for example. Also, we can use another drugs. For example, in the intraoperative, when we have an urgency hypertension, that it's very common for the pain, we can use some anesthetics.
Okay, that's interesting. What kind of anesthetics?
The most common anesthetics that get lower the blood pressure are propofol, midazolam, also of the sevoflurane, also the opioids had the same action. And when you use it together, they can potentiar.
Okay. Let me check. I forgot that word.
Yeah, it's late. I think both are tired. I don't know.
Maybe it's because of that. I'm so sorry.
Yeah,
But I have you. I'm so sorry. I'm really sorry for that.
I'm on the same station.
There are a lot of people in our class, and we will do for the next classes to change schedules. Okay, we will switch, and I think it would be fair enough for everyone to make this. I hope they don't have any trouble with that. Okay.
All the people that participate more in the class can choose the first schedule.
Yes, could be.
Maybe the others can participate more on that way to not be awake at this time.
Yes, that's good. That's oh, sorry.
Good idea.
That I'm writing. I don't know what I'm doing. Okay. Enhance.
Yes. Yeah. So both drugs can enhance the action to get lower the blood pressure.
Okay. Thank you so much. We were like kind of sleepy.
Yeah. Yeah,
Okay.
me too. I was working all the day. So tired. Yeah.
Just one more thing, and I will let you sleep, I swear.
Okay.
Can you choose another circulation disease and explain to me?
Another circulation disease. I don't know. Blood. Hypotension. No.
Well, you want. Or thrombosis.
Oh.
I don't know.
Thrombosis. Okay. Or embolia, I think, or ictus.
Okay.
Okay, embolia, it's when a thromb gets up to the brain and can block some principal artery on the brain. In that case, it's very common in the people who has a kind of an arrhythmia. And that's why for the arrhythmia, they are more propensos. They are usual to get coagules or thrombosis in the brain.
Okay.
So the people
the patient can have so many different symptoms, like the symptoms of focalization or focal symptoms, I think, when can move one side of the body, or have a paresthesia and have a lower movements of that side of the body, the hands, of the foot. That's are the focal symptoms. Also, they have bradypsychia, and they can explain, and their thoughts are more slowly when they are talking. That's another symptom. Another sign, it can be the pupil can be dilated in one side. So that's another sign that it can be a trauma of the brain. When we have the trauma of the brain, we have an gold hour to get action. So the principle is to identify the most faster possible the symptoms, and get the treatment, to inject directly by a catheter that can use it for some artery. You can administrate streptolysin. In that case,
what is that?
Streptolysin is a drug that can destroy the drum.
Okay.
Sorry.
No
And if you act in that gold hour, the patient can recover all the functions of the body in the fastest way.
Okay, streptolysin.
Streptolysin.
Okay.
Or streptolycina in Spanish.
Yeah. Okay, Claudia, I will let you sleep now. Thank you so much. I will send to you my questionnaire.
Okay.
And I will ask you please to fill it. And you know, we're gonna replace the first practical class, but I have the later schedules now, right now. So I don't know. Maybe we can do it another day with you if you agree, because I have on Monday.
You say that on Monday, and yeah, but in Monday you yesterday let us choose.
I'm so sorry.
And I said,
yes,
I'm the
you're
first
lying. I'm so sorry.
Because
I
know
almost
how
sent you
it's like
to
this
the
time.
class. Yes. Okay. Thank you so much. Then I will let you.
Next to other
I will let
people.
you sleep now. But just just one thing.
What is the
And
name of that practice?
It's the first one, but I will send you by the group.
Okay.
So you can practice a little bit and watch maybe the video if you want, and just have a talk, okay, with this class. Okay, thank you so much, Claudia. Now you
Okay,
can
thank you
rest.
too.
Have a great night.
Yeah, thank you.
Thank you for
too.
the patience.
No, thank you too.
Bye bye. Good night.
Bye.